Biden administration proposing sweeping changes to medical debt. Americans could have their medical debt dropped from their credit reports. They still have to pay their bills, but the debt no longer would be considered when you're, buying a home or getting a car loan, that kind of thing. The plan could reach at least 15 million Americans, estimated to have $49 billion in medical debt. Eva Stahl joins us on this. She's Vice President of Public Policy and Program Management for the nonprofit Undue Medical Debt. All right. Tell us about this in terms of what the practical impact would be, assuming you think it's a good idea for Americans if it happens.
Sure. Thanks for having me. I would say, first of all, it's a great thing. It's a great thing for patients because patients need this off their credit report so they have access to housing, they have access to lines of credit, so they can live daily lives. So the practical implications are that people that continue to have medical debt on their credit reports will see it removed. So this will affect, as you noted, about 15 million people and is about over close to $50 billion worth of medical debt.
All right. Let me make a few points about it. Axios writes about the administration looking to make this move. The medical debt can be particularly pronounced in some racial and ethnic groups. Roughly 37.5% of black middle-class people having unpaid medical debt compared to 23.5% of middle-class people overall is what they cite in that article. And then I want to play a clip from the senior counsel at the Consumer Financial Protection Bureau about, the fact that people end up, when they get sick, they shouldn't, have to pay a price or be punished. Let's watch.
Americans are effectively getting punished for just getting sick, and that's something that's fundamentally unfair. Americans should be able to focus on getting better, especially when they're, recovering from an illness, often when it's, a sudden and unexpected illness.
Here's what I would ask you, though. Is the incentive structure right with this? Wall Street Journal's editorial page raised some questions. We could put them up on the screen right now about the cost of forgiving medical debt. And they write that removing a credit notice for not paying medical bills will result in more unpaid bills. It will also reduce the incentive to buy health insurance and will undermine the administration's goal of increasing coverage. What would you say?
I would say that medical debt is not a choice. It's a debt of necessity, right? So as noted, that people can't help it if they get sick. More importantly, I think that the health finance system is flawed, right? And we need to find solutions that hold patients harmless. So this is a step in the right direction. And it's also one that's not a big market shift because we've also seen over the past 5 or so years a decline in credit reporting with respect to medical debt. So it's not as big as a leap as everyone's perhaps making it out to be.
Okay, so it wouldn't take away that incentive, you don't think, or change it to buy insurance and have fewer people covered?
No, I think people still know that insurance is the best way to protect yourself from medical debt. And I can say from our experience as helping people across the country with their medical debt that people very much want to pay their bills. This is really going to be a good incentive for getting people to go back to the doctor.
Okay. Let me go through some numbers that we have, and I think I have them on the tablet here about how much Americans actually owe. We mentioned some of this already, but when you see it up there, it's a lot. You just think about the numbers that are in the thousands. So if you start here where it's 25%, that's 2,000 to 5,000. Everything above that, so that's 25%. Then 13% between 5,000 and 10,000, 14% between 10,000 and above. So there's a lot of people owing a lot of money here. We look at it by age, which is what I just switched the screen to now. There's people, kind of working people, 35 to say 64. Those two middle screens there, you got a lot in that group. So there's a big effect on a lot of people. Yeah,
it definitely is. And I think 2 important points there are that as people get older, they have more health issues, right? And so they're going to accrue more medical debt. That makes a lot of sense. But it's also worth noting that even the smallest debts, right, $500 plus, we hear from people that it keeps them up at night, right? It causes them to delay care because they don't want to accrue more. So taking this off credit reports is definitely a step in the right direction to get people healthy.
All right, we'll follow it, see where it goes. Eva, thank you very much for coming on. Thanks so much for watching. Just go to joinnn.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.